This is endoscopy view of middle-aged female who presented to us with iron deficiency anemia. You can see the duodenum appears to be normal. As we see the stomach, there appears watermelon appearance of the antrum. This is called GAVE or gastric antral vascular ectasia. This occurs in conditions like cirrhosis, chronic kidney disease, and some autoimmune diseases. You can see the ectatic vessels very clearly. They can produce small ooze. Coming back, we can see some evidence of portal hypertensive gastropathy also in this patient. So you can see over here portal hypertensive gastropathy, since she was a diagnosed case of cirrhosis of the liver and compensated cirrhosis. Coming back into the esophagus, we can see grade 1 varices. Also, the patient was bended previously, so we can see some areas of fibrosis because of previous bending. Thank you.